and I really think this is going to help you get better, and you will get better. And if not, I want you to call me, and I want to see you again in a few weeks to make sure you're getting better.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
I've got this delightful gentleman for you to look after. You might know him. He had a few frequent admissions. Got 3 words for you. He's mobile, he's independent, and he's alert. He's on, he's got heart failure. He's on a beta blocker. He's got ACE inhibitor, and he's anticoagulator as well. But the problem is, you have to look after him like an eggshell without cracks. Well, I guess you're okay with that. He's got bilateral leg dressings. He's got a few social issues as well, but the discharge coordinator will, fill you up with that. Rest is all as per the pathway. I can take an easy early minute now you've come in. I've heard like you're going to America. Oh God, we're going to miss you so much. Enjoy.
Question 26. Now read the question.
Mr. Fernandez is a 52-year-old gentleman who was admitted to the ER last night. He lives with his wife, Judy, and was found down at home. They also noted he had lower extremity swelling for 5 days and was experiencing some shortness of breath and weakness. When they arrived to the emergency room, he was found to be in atrial fibrillation with a rapid ventricular rate between the 150s and 160s. After 2 boluses of diltiazem, he was started on a drip. He has 2 peripheral IVs, an 18 gauge in his left hand and an 18 gauge in his left. Both were started in the emergency room. Mr. Fernandez is a high fall risk because he fell at home. His bed alarm is on at all times and his call bell is within reach.
Mr. Fernandez, since you fell at home, you're considered a high fall risk, so we need to keep the bed alarm on at all times, okay?
Okay.
And if you need any when you get up, you need assistance, so make sure that you call when you're getting out of bed.
I will use this red button on this.
Okay, so we can count on you guys to call when you need help, right? I need to go get a report on my other patients, so I'll be back in about 20 minutes. But if you need anything, make sure you call, okay?
Okay, thank you. Sounds good.
You're welcome.
Question 27. Now read the question.
During your stay, we will work to keep you as comfortable as possible. Unfortunately, it is unrealistic to feel zero pain after surgery. Our goal is to manage your pain at levels allowing you to participate in physical therapy and other activities. We have many tools to attack pain, starting with the peripheral nerve catheter, or PNC, inserted into your operative leg by the anesthesia team. The PNC delivers numbing medication to surround the nerve that supplies feeling to your hip or knee. We supplement the PNC with other medications as needed, either in pill or IV form. One big help in controlling your pain is to keep your new joint active by moving and working with therapy. Lying in bed too long can result in more pain as the joint grows stiff. In addition to pain medication, you will receive a 10-day supply of Lovenox.
Question 28. Now read the question.
Patient expectation is paramount in the preoperative consultation, because sometimes patients come to you with a wrong expectation. Wrong expectation means that the whole post-operative pathway goes wrong. Okay, so this goes into the initial few consultations after we ask them structure the questionnaire about themselves, their eating habit, their family history, their attempt to lose weight, and their other comorbidities, and then we discuss with them their choices of procedures and what to expect from each choice. Okay, and these choices will be modified by their ability to comply with the dietary program and do exercise to help the weight loss.
Question 29. Now read the question.
Today I'm going to be talking about a BiAmp overhead paging system along with a Rowland-Borg nurse call system and the power of connecting those two together. We can automate code blue processes so that when a code blue is pressed, it can automate a response overhead to the paging system, which I'll demonstrate right now.
Attention. Code blue. Room 501. Medical ICU.
Okay, now the power of this is that, like it said, medical ICU right there, we can add any suffix we want onto that and give clear delineation on where the code blue is coming from and where the staff needs to go to respond to that code. I can make it repeat. We can add different preambles, as you heard a preamble before that. It is really a powerful tool, and I'd love to talk to you about it.
Question 30. Now read the question.
First and foremost, I think 20 is the new 25. When we studied glaucoma in school, most people were under the impression that 25 millimeters mercury was the high end of normal. We've found that recently, at 20 millimeters mercury, the intraocular pressure is elevated enough to be adequate, but at 25, it's really starting to affect exoplasmic flow on the optic nerve. So really aim for a pressure of 20 in your veterinary patients. Other things that are new in the realm of glaucoma and pets include the realm of neuroprotection, so medications like memantine, timolol, bimatoprost, and minocycline, which may actually protect the nerve and the nerve function. We are starting to look at glaucoma as more of a neurodegenerative disease, so not only a disease of the eye, but also a disease of the brain, and it can actually be affected by systolic blood pressure as well as intracranial pressure.
That is the end of Part B. Now look at Part C.
Now, we are going to check our answers. answers, please. Check your answers, please. Yes. So, Muhammad Iqbal, okay. Chandrika 4/6. Muhammad Iqbal 2/6. Rakil 3/6. Smita Kanta 4/6. Right. What about the others? Dua 3/6. Others, share your answer. Scores. Joseph Palraj 2/6. Okay. What about the other students? Okay, fine. So, Dua 3, Meera Manoj 5/6, Joseph Palraj 2/6. Okay, fine. So, total scores out of 30. Now, add to the previous ones. Okay, add those who have done part 1, part 2 of extract 1, extract 2 of part 1 and part B. Muhammad Iqbal got 18/30. Smita Kanta got 25/30. Okay. It's not 25/30. Sorry. It's how many? 24 plus 6, 30, no? 24 plus 6, 30 only. Correct. 30. So, Smita, you require to get only 5. If you get in part C, that's enough. You have to get only 5 in part C. Chandrika, you need to get only 4 in part C. That's enough for passing score. But I have to check your handwriting in part A because many people lose their scores because of part A. Yeah. What about the others? Total scores, please. Rakil 13, Dua 13. Yeah, Joseph Palraj, what is your score? Meera Manoj, what is your score? And next, okay, Esther. Okay, add the totals. Add the totals. Yeah. Fine. So stop live stream. Joseph Palraj, 10/30. Okay. Anybody else?